Good morning, everybody. I welcome all the undergraduate students of MR Medical College. Myself, Dr. Rajesh Patil, signing in for yet another pathology session. The title for HIV, that is AIDS, acquired immunodeficiency syndrome caused by HIV virus. So, this is a fatal illness caused by a retrovirus. So usually when we write in the case sheets in the wards, a test for retrovirus we write, because we don't write test for HIV, because that will be understood by the attenders of the patient or the patient himself. So some social taboo is there. So we usually avoid that. So they may question you, why you're testing me this. So in case if we suspect such disease in that patient, we need to do a test on HIV, but at the same time we can't reveal that we are doing such test on the patient, because it's social taboo. So usually write test for retrovirus, so that won't be understood. HIV is easily understood, so it's very popular. So the name. Definition: AIDS is a disease caused by the retrovirus, human immunodeficiency virus, and characterized by profound immunosuppression that leads to opportunistic infections, secondary neoplasms, and neurologic manifestations. Acquired immunodeficiency syndrome is principally a disease of lymphoid tissue, because main target of HIV is CD4 plus T cells that primarily resides there. Epidemiology: males commonly, it involves males more than females, occurs in all ages and ethnic groups. All areas of country are affected. AIDS is the second leading cause of death for all men aged 25 to 44 years. See this, second leading cause. What's the age? 25 to 44. So by the year 2011, HIV had infected 60 million people worldwide, and nearly 30 million adults and children have died of this disease. There are about 34 million people living with HIV, of whom 70% are in Africa and more than 20% in Asia. The prevalence rate of infection in adults in sub-Saharan Africa is more than 8%. It is estimated that 2.5 million people were newly infected with HIV in 2011, and 1.7 million deaths were caused by AIDS. Mode of transmission: homosexual or bisexual men constitute the largest group, accounting for more than 50% of the reported cases. Intravenous drug abusers with no previous history of homosexuality are the next largest group, representing about 20% of infected individuals and 9% of new cases in 2009. Hemophiliacs, especially those who received large amounts of factor 8 or factor 9 concentrate before 1985, make up about 0.5% of all cases. Recipients of blood and blood components, usually we should avoid receiving blood, but when there is no, of course nowadays a lot of testing is there, the HIV testing, the HBsAg, the blood transfusion related diseases are all screened, but still if it's avoidable, try to avoid. If unavoidable, then only be a blood recipient. So who are hemophiliacs but who receive transfusions of HIV infected whole blood or components, the platelets, the plasma. See, how did the Amitabh Bachchan is HBsAg positive. So one suspect how he might have got this infection. So he might have got this by blood transfusions when he underwent splenectomy, the rupture of this organ, frequent blood recipient he was. He received a lot of blood pints post trauma. So that's the way how he might have got this HBsAg virus. Is positive for that. Mode of transmission: unprotected sexual intercourse with an infected partner, vertical transmission, then injections, drug use. So this might lead to HIV infection. HIV infection of the newborn. The epidemiology of AIDS is quite different in children younger than 13 years. Close to 2% of all AIDS cases occur in this pediatric population, and worldwide more than 5 lakh new cases and almost 4 lakh deaths were reported in children in 2006. In this group, the vast majority acquired the infection by transmission of virus from mother to child. The three major routes of transmission are sexual contact, parental inoculation, and passage of the virus from infected mothers to their newborns. Sexual transmission is clearly the dominant mode of infection worldwide, accounting for more than 75% of all cases of HIV transmission. Next is the parental transmission of HIV has occurred in three groups of individuals: intravenous drug abusers, hemophiliacs who received factor 8 and factor 9 concentrates, and random recipients of blood transfusion. Coming to the etiology, HIV is a non-transforming human retrovirus belonging to the lentivirus family. Two genetically different but related forms of HIV called HIV-1 and HIV-2 have been isolated from patients with AIDS. HIV-1 is the most common type associated with AIDS in the United States, Europe, and Central Africa, whereas HIV-2 causes a similar disease principally in West Africa and India. So most common is HIV-1, whereas HIV-2 principally in West Africa and India. Causes, contributors of HIV risk. So this is another schematic diagram here. The racism, the stigma, poverty, gender inequality, migration. Structural level: resource availability, physical environment, organizational systems, laws, policies. Community level: community norms, social networks. Social networks increases the nowadays. A lot of people are active on socially. So this leads to new friendship, new encounters, and new risks. Always remember that. Always there are more risks involved in fun. So if you want to have fun, always think that it's always involved with the risk. Collective efficacy, relationships. Individual level: behavior, attitudes, knowledge, perceptions, and biology. So this is a schematic diagram here. And then ultimately, how strong you are. What's your immunity status? That's the reason you see nowadays COVID-19 affects a person in a pair. It might affect the husband but may spare the wife. Both will be sleeping together for 10 days, 15 days, 20 days, but the patient, only husband has the symptom and is infected with COVID-19, whereas wife might be spared. So this all depends basically ultimately with your immunity levels, your threshold. So individual susceptibility. Structure of HIV. Similar to most retroviruses, the HIV-1 virion is spherical and contains an electron-dense cone-shaped core surrounded by a lipid envelope derived from the host cell membrane. The virus core contains the major capsid protein P24, nucleocapsid protein P7, P9, 2 copies of viral genomic RNA, and the 3 viral enzymes protease, reverse transcriptase, and integrase. So this diagram can be asked for a 3-mark question also. The glycoprotein 120. The P24 capsid, really important one. Lipid bilayer, integrase, protease, RNA, reverse transcriptase. So the glycoprotein surface, glycoproteins are really important. So this diagram you should be well aware of. Sometimes the diagram is also asked in your exams. P24 is the most abundant viral antigen and is detected by an enzyme linked immunosorbent assay that is widely used to diagnose HIV infection. The viral core is surrounded by a matrix protein called P17, which lies underneath the virion envelope. Studying the viral envelope are two viral glycoproteins, GP120 and glycoprotein 41, which are critical for HIV infection of cells. The HIV-1 RNA genome contains the GAG, POL and ENV genes, which are typical of retroviruses. The products of GAG and POL genes are large precursor proteins that are cleaved by the viral protease to yield the mature proteins. In addition to these three standard retroviral genes, HIV contains several other accessory genes, including TAT, REV, VF, NEF, VPR, and VPO, which regulate the synthesis and assembly of infectious viral particles, and the pathogenicity of the virus. Life cycle of HIV. So how it affects, this is a very important one. So the viral entity here, the virus GP41, GP120, glycoprotein 120, CD4 binding with the cell surface here, conformational change of CD4 binding here, then the glycoprotein 120 CD4 binds CCR5 receptors, GP41 membrane penetration. Slowly how this viral body comes and attaches here, see, to the cell membrane and penetrates the membrane fusion, the fusion of HIV membrane with host cell membrane, entry of viral genome into the cytoplasm. So cell membrane of the cell wall is broken, lysed, and then there is entry of this virion body inside the cytoplasm of the cell after the breakage of the cell membrane, leading to integration of provirus into the host cell genome. So HIV RNA transcripts HIV DNA provirus. So cytokine activation of cell, transcription of HIV genome, transport of viral RNAs to cytoplasm. So leading to synthesis of HIV proteins, assembly of virion core structure. So budding and release of new HIV virion. So multiplication of the viruses. Pathogenesis. Again the schematic diagrams here. Infection of mucosal tissues. CD4 T cell receptors, attachment dendritic cell. These recognize this virion. The virus transported to lymph nodes. Death of mucosal memory CD4 cells, T cells. Infection established in lymphoid tissues, the lymph nodes. The viremia. Spread of infection throughout the body. Anti-HIV antibodies, the HIV specific cells, the T lymphoid cells, So this is another flowchart here. Partial control of viral replication, establishment of chronic infection, virus concentrated in lymphoid tissues, low level virus production, leading to increased viral replication, leading to destruction of lymphoid tissues, depletion of CD4 plus T cells. The initial infection starts in mucosal tissues involving mainly memory CD4 plus T cells and dendritic cells and spread to lymph nodes. Viral application leads to viremia and widespread seeding of lymphoid tissue. The viremia is controlled by the host immune response, and the patient then enters a phase of clinical latency. During this phase, viral replication in both T cells and macrophages continues unabated. There continues a gradual erosion of CD4 plus cells, and ultimately CD4 plus T cell numbers decline, and the patient develops clinical symptoms of full blown AIDS. Four stages of HIV. Stage 1, primary flu like illness, occurs 2 to 6 weeks after infection, or there may be no symptoms at all. Infected person can infect other people too. Stage 2, asymptomatic. This stage is free from symptoms. There may be swollen glands. HIV antibodies are detectable in the blood. This stage lasts for about 10 years. So this is stage 2, asymptomatic. Stage 1, primary. Stage 3, symptomatic. The person starts showing symptoms like fever, skin diseases, the immune system deteriorates, opportunistic infections. Stage 4, the immune system weakens. The illness becomes more severe, leading to AIDS. The illness becomes more severe, leading to emergence of opportunistic infections and cancers. So HIV infection and antibody response. So initial stage flu-like symptoms, the schematic diagram representation there. 6 months, years, the viral, the antibody titers. Clinical features: diarrhea, fatigue, weakness, fever, headache, joint pain, night sweats, rash, swollen glands, weight loss. Yeast infections, mouth or vagina that lasts a long time or occur frequently. The acute HIV syndrome follows 3 to 6 weeks following primary infection. That is acute HIV infection. All these again diagrammatic representations. How it involves the mouth, pharyngitis, lymph nodes, esophagus, muscles, myalgia, skin rashes, gastric, lungs, so different organs being involved. So esophagitis, chronic diarrhea, even tumors also. So these opportunistic infections here: tuberculosis, candidiasis, cryptococcosis, herpes zoster. So all these secondary infections. Sometimes HIV is diagnosed with the presentation of secondary tuberculosis. So many times, especially in this region, surrounding villages like Javri, Shahpur, and all. So once you diagnose a new case of tuberculosis, do a secondary HIV test in such patients from such areas. Invariably, they will be HIV positive most of the times. So most of these HIV positive patients presents to you with tuberculosis infection or some other fungal infection. Always have that in your backdrop of your mind. Swollen parts of the body. Deterioration of body tissues. Extreme weight loss, lymphadenopathies, Carani pneumonitis, lymphomas. So all this: Candida, Cryptosporidium, cryptococcal infections, cytomegalovirus, histoplasmosis, mycobacterium, toxoplasmosis, tuberculosis, second infections. Neoplasms associated in patients with HIV infections. Tumors. Patients with AIDS have a high incidence of certain tumors, especially the Kaposi sarcomas, B cell lymphomas, cervical cancers, anal cancers. So 40% of untreated HIV infected individuals usually develop a malignancy. A common feature of these tumors is that they are caused by oncogenic DNA viruses, specifically Kaposi sarcoma herpes virus, EBV. Even in healthy people, any of these viruses may establish latent infections that are kept in check by a competent immune system. The increased risk of malignancy in AIDS patients exists mainly because of failure to contain the infections and reactivation of the viruses, as well as decreased immunity against the tumors. Kaposi's sarcoma, candidiasis of mouth, lab diagnosis of HIV. How you diagnose basically the HIV infection, that is important. ELISA, enzyme linked immunosorbent assay, is used to detect HIV antibodies. A positive ELISA must be confirmed by Western blot. That is very important, okay? Always needs confirmation. An immunofluorescence assay to detect specific HIV proteins. HIV core protein P24 is the most abundant protein produced by HIV. Anti P24 reliably detected antibody but declines as viral titers rise in late infections. So P24 is reliably available antigen for detection. Measurement of CD4 lymphocyte levels and viral load are often useful indexes of the disease progression as well as the effectiveness of the antiretroviral therapy. So CD4 plus lymphocyte levels should be always assessed and detected to know the viral load and stage of the disease. So in fact, WHO definition most of the times doesn't define ELISA positivity or Western blot test positivity, but it defines in the form by CD4 cell count less than 200 cells detects the positivity of HIV. So that's the WHO definitions. Prevention, practice safe sex, condom use, abstinence, sharing of used needles among IV drug abusers, implement effective screening of blood products in all countries, increase voluntary HIV screening in high risk individuals. Like in India, it's lorry drivers or long route taxi drivers where they get tempted on the way somewhere here and there and they poke their nose here and there and get infected with HIV, and then they come back home after 15 days or 20 days of workload travel and infect their wives. So such high risk individuals should be screened. Self awareness. So all these fall an important aspect of AIDS, the HIV. So not only here we saw the WHO definition of HIV, the presentation, the signs, the symptoms, what all it can cause in different organs, different system, how it can impair, and the types HIV1, HIV2, then the lab investigations, ELISA, Western blot, PCR test, then the CD4 cell counts, the therapy, the treatment, the mode of treatment in HIV patients, the AIDS, preventive measures, the abstinence, safe sex, condom use, and how these blood products to be screened before giving to the patients. So of course HIV spreads very rarely by needle prick. It's very less chance, 0.001% chances or less than 1% chance by needle prick spread, but most commonly by the homosexuals, or it can spread by sexual activity, unprotected sex. So common mode of transmission. But people, doctors, nurses, if they get by needle prick, it's a very bad scenario, very unlucky mode of spread. but chances of spread by needle prick is very less, bleak, but still chance is a chance, risk is a risk. So always be careful while performing surgeries or giving injections. So always make sure the needle that you use on the patient doesn't prick you, doesn't hurt you in a hurry, or always take care of that. So this HIV is not only important from clinical point of view, so you will deal this disease in every subject, in every subject of medicine, surgery, gynecology, pediatrics, pathology, microbiology, everywhere. So clinically it's important, and also important from the exam point of view. In every other subject it can be asked as a question. So having knowledge about this is very important for you. So the session concludes here. Myself, Dr. Rajesh Patil, signing out from this pathology session. Meet you all very soon in my next class. Thank you.